Assalamualaikum and hi. Today our group will present about food allergies and intolerances. And this is our group members. We are from class AS1203A.
Hello everyone. Today I will be talking about food allergies and food intolerance. Although these two conditions may seem similar, they are actually very different in how they affect the body. What is food allergy? A food allergy is an immune system reaction. This happens when the body mistakenly sees a food protein as something harmful. As a result, the immune system releases chemicals such as histamine, which can cause serious symptoms. What is a food intolerance? On the other hand, a food intolerance is related to the digestive system, not the immune system. It occurs when the body cannot properly break down certain components in food, like lactose or gluten. This condition is usually less dangerous, but can still cause discomfort. So now, let's look at the difference between a food allergy and food intolerance. Food allergies and intolerance affect the body differently. Allergies involve the immune system and react quickly to food proteins, sometimes causing serious reaction. Intolerance affects the digestive system, develops slowly, and usually causes stomach discomfort like bloating or cramp. People with allergies must avoid the food completely, while those with intolerance can usually reduce or limit.
Next is common food allergies and digestive effects. The main digestive effects of food allergies is abdominal pain. Abdominal pain is when discomfort or cramping in the stomach after eating the food allergen. Second point of digestive effect is vomiting. The body tries to remove the allergen from the stomach. And next is diarrhea due to irritation in the digestive tract. Next is nausea, feeling like you want to vomit. And last is inflammation of the intestinal lining. The wall of the intestine becomes swollen and irritated, which affect digestion. And the common food of allergies is include peanut allergy. One of the most serious allergies can cause several reactions. Next is shellfish allergy, usually triggered by prawns, crab or lobster. And egg allergy, especially in children. And lastly is cow milk allergy. The immune system reacts to protein in milk. Food allergen activate IgE antibodies, leading to histamine release and inflammation of the intestinal lining. Okay, now I will explain about food intolerance and their digestive effects. Food intolerance happens when the body cannot properly digest certain types of food, usually because of enzyme deficiency or poor absorption. First is lactose intolerance. This occurs when the body has low level of the lactase enzyme, which makes it hard to digest lactose found in milk and dairy products. And next is gluten intolerance. In this condition, the body struggles to process gluten, which can lead to digestive discomfort such as bloating or stomach pain. And lastly, for food intolerance is fructose malabsorption. Here, the small intestine cannot absorb fructose efficiently, causing symptoms like gas or diarrhea. For digestive effect of food intolerance is bloating and gas, because indigested food gets fermented by good bacteria. And next is abdominal pain. Gas build-up stretches the intestinal wall. And next is diarrhea or constipation. poor absorption, change water movement in the goods. And lastly is nutrient malabsorption. Food isn't broken down properly, so the body absorbs fewer nutrients. So overall, food intolerance mainly affect the digestive system and cause discomfort, but they are usually less dangerous compared to food allergies.
Hi, my name is Nora Zawiza and I'm going to explain about the mechanism of the digestive system. Think of it as a food adventure ride where every stop has a special job to do. First one, ingestion. It all begins at the mouth, the gateway. Here, our teeth act like a scissors which is cutting food into smaller pieces. Saliva is a secret sauce softening food and starting the breakdown of starch. Imagine it as the first chef in the kitchen. Second, the esophagus. This is like a food slide. Muscles push food down in a wave-like motion called peristalsis. It's like a conveyor belt moving food to the stomach. Now the stomach, the mixing bowl. It churns food with gastric juice, turning it into a soupy mixture. Think of it as a blending ingredients for a recipe. Here comes the magic lab, the small intestine. Enzymes from pancreas or bile from the liver break food into its building blocks. Sugar, amino acids, and fatty acids. It's like taking apart Lego pieces so the body can reuse them. Tiny finger-like structure called villi absorb nutrients into the blood. Imagine millions of little straws sipping up the goodness from food and set it over the body, which is absorption. Next is large intestine. The large intestine is to recycle. It absorbs water and minerals, leaving behind waste, and it's like squeezing out the last drop before throwing away the leftovers. Finally, the waste exits through the rectum and anus. The digestive journey ends here, and the body gets what it needs and discards the rest. So the digestive system is not just about eating, it's a well-organized adventure where every organ plays a role, from the mouth to the exit. It's a teamwork to its finest. Thank you. Next, we will explore how doctors investigate problems in the digestive system. Think of it as a detective work inside the body. Each method helps uncover clues about what's going on. First, the first step is simple. Talking and observing. Doctor asks about symptoms like pain, nausea, or change in the bowel habits. Then, they examine the abdomen, pressing and listening and checking for tenderness. Or swelling is like gathering the first clue in the mystery. Next slide. Lab tests provide deeper insight. Blood tests can show anemia or infection. Stool tests check for hidden blood, parasites, or bacteria. These tests are like a lab detective, analyzing samples to reveal hidden problems. Sometimes doctors need to look inside directly. Endoscopy uses a flexible tube with a camera. An upper endoscopy checks the esophagus and stomach, while a colonoscopy explores the large intestine. Capsule endoscopy is even cooler. You swallow a tiny camera tube that takes pictures as it travels. Next is imaging technique. Imaging is like taking snapshots of the digestive system. X-ray with barium outline organs, ultrasound check the liver and gallbladder, and CT or MRI scans give detailed cross-sectional view. These pictures help spot blockage, inflammation, or tumors. Finally, functional tests measure how well the system works. Motility studies track how food moves, pH monitoring checks acid level in the esophagus, and breath tests detect bacterial overgrowth or lactose intolerance. These tests show not just structure but function. So, diagnosing digestive problem is a step-by-step process. History, lab tests, scopes, imaging, and functional studies. Each method adds a piece to the puzzle, helping doctors find the cause and guide treatment.
So next, we move to the dietary management. First, individuals with food allergies must completely avoid their trigger food. Even a very small amount can cause a serious reaction, so strict avoidance is extremely important. Next, we need to check food labels carefully. Many allergens appear under hidden names, such as casein for dairy or soy derivative. By reading labels, we can prevent accidental exposure. Next, we use safe alternative. For those who still want to enjoy similar food, we can use alternatives such as lactose-free milk, gluten-free bread, or plant-based milk. This choice helps reduce symptoms without affecting overall nutrition. Next, enzyme supplement. For food intolerance, enzyme supplement can help. A common example is the lactase enzyme for lactose intolerance, which allows the body to digest dairy more easily. Lastly, portion control and food diary. Some individuals may tolerate small amounts of certain food. Keeping a food diary helps identify patterns, triggers, and the right portion that is safe for them. Next, we move to the prevention strategies. Firstly, gradual introduction of new food. To prevent reaction, new food should be introduced slowly and in small amount. This gives the body time to adapt and reduce the chance of sudden allergy or intolerance reaction. Next, maintain a healthy gut support both the immune and digestive system. Eating a balanced diet and taking probiotic can help reduce sensitivity to certain food. Next, avoid cross-contamination. Cross-contamination is a major risk, especially for those with severe allergies. Allergen can transfer through utensil, surface, or cooking oil. So proper food handling and kitchen hygiene are essential. Lastly, individuals with high-risk allergies should always carry emergency medication such as epinephrine or antihistamines. This step is important to prevent serious complications in case of accidental exposure.
Continuing to complication in food allergy, there is anaphylaxis that usually occur in short time after exposed to the allergen. It can still occur after half an hour or more. Then, the symptom includes skin reaction such as hive, itching, flush, or pale skin. There are also low blood pressure, constriction of airway, and a swollen tongue or throat can cause wheezing and trouble breathing. Then, there is weak and rapid pulses. After that, nausea, vomiting or diarrhea, and lastly, dizziness or fainting. And secondly, there is angioedema, which is swelling that occur when your body is exposed to allergen. The swelling on body part, such as face, eyelid, throat, and airway. It can be fatal if the swelling worsen on throat and airway. It can last between hours and days. Then, there is food intolerance, which is malabsorption. It is a long-term intolerance, such as lactose or gluten intolerance, can cause poor absorption of essential nutrient, weight loss, vitamin and mineral deficiencies. For example, lactose intolerance have low calcium and vitamin D, causing them to have weaker bones. And lastly, it's chronic digestive discomfort, which is a persistent bloating, gas and abdominal cramps, frequent diarrhea or constipation, and lastly, nausea after eating certain food allergies and food intolerance both affect the digestive system, but they differ greatly in their causes, symptoms, and severity. Food allergies involve the immune system and can lead to serious complications such as anaphylaxis and angioedema, while food intolerance are mainly due to enzyme deficiencies or absorption, causing chronic digestive discomfort and nutrient deficiencies. Understanding these differences is important for accurate diagnosis, proper dietary management, and prevention of complication. With careful food choices, medical guidance, and awareness of trigger, individual can manage both conditions effectively and maintain a healthy quality life.